The phone call always starts the same way. A son or daughter says, "My mother has been trying to study for the citizenship test for 2 years, and so she can't do it. Does she qualify for the medical waiver?" It's the right question. And today I'm going to answer it the way I answer it in my office. Honestly, specifically, and without false hope. I'm Dr. Gurpreet PADDA, a physician and USCIS civil surgeon in St. Louis. And this is who actually qualifies for the Form N-648 disability exception, and who doesn't. The law sets 3 requirements, and all 3 must be true. First, there must be a real diagnosable medical condition, a physical disability, a developmental disability, or a mental impairment. Not stress, not being tired. A condition a physician can document. Second, that condition must have lasted or be expected to last at least 12 months. A temporary illness doesn't qualify no matter how serious it was. Third, and this is the one people miss, the condition must actually prevent learning English or civics. Not make it harder, not make it slower, make it impossible. That word matters. Because it's the word the immigration officer is testing. So what conditions meet that standard? In my experience, the strongest cases involve dementia and other major neurocognitive disorders, a brain that cannot form new memories, or cannot memorize civics answers in any language. Stroke, when it has damaged memory, language, or learning centers. Intellectual and developmental disabilities present since childhood. Severe, treatment-resistant psychiatric illness, including severe PTSD, which I see often in our refugee communities when it genuinely destroys the capacity to concentrate, retain, and learn. Notice what all of these have in common. They can be documented, tested, and explained with medical evidence. Now the honest part, because a trustworthy doctor tells you what doesn't qualify. Age alone does not qualify. Being 80 is not a medical condition. Illiteracy alone does not qualify. Never having learned to read is not a disability under this law. Ordinary anxiety about tests, mild memory changes of normal aging, or simply finding English difficult. These do not qualify. And one absolute bar written into the law: if the condition is the result of illegal drug use, the exception is not available. If someone tells you every case qualifies, they are not evaluating, they are selling. At our office, we don't guess. Before any evaluation, we review your loved one's actual medical records. We charge a $400 case acceptance fee, credited in full toward the evaluation if we accept the case. If the records don't support a qualifying condition, we tell you directly and decline. If they do, we perform a structured evaluation. Validated cognitive testing. I'm a MoCA-certified rater, administered in your loved one's own language through an interpreter. And we say this in writing to every family. Only USCIS decides whether a Form N-648 is sufficient. No physician can guarantee the outcome, and anyone who promises approval should not be trusted. If the person you love has a real, lasting medical condition that has made learning truly impossible, the law may already be on their side. Start by gathering their medical records: neurology, psychiatry, primary care, hospital records, brain imaging. Then text us at 31488-65902 or visit immigrationexam.us and we'll review the case honestly. I'm Dr. Gurpreet PADDA. Truth first, always. Thank you for watching.